We need to put together a basic or a core package that this is the bare essentials that is required for cancer care. And then depending on the type of cancers in the country, the affordability, the healthcare models, this can be built on and you can give people proper cancer care. Putting it simply, it's like putting a toolkit or a checklist together to give policymakers. We are targeting cities with over 1 million population. Give them this toolkit or checklist with the bare essentials of cancer care. And then again, you develop on it according to the needs of the particular city. We sincerely believe that one size doesn't fit all and it has to be tailor-made to. We plan to impact on the outcomes and the care that people get for cancer in cities that do not have a good cancer solution model.
I really believe that by looking at the continuum of care going from preventive medicine all the way through to the treatment to post-acute care to end-of-life type of issues, these cities will be very successful in accomplishing their goal. Well, in 10 years, hopefully we'll move from 3 to 5 centers to 25 centers that will become models for cancer care in emerging markets and developed, semi-developed countries around the world. To grasp this and embrace it and to look at it as an opportunity to set up model cancer care for the world.
The CCAN initiative is something that is about to get off the ground early in 2017. It's something that I'm particularly excited about, not least because we do now have, I think for the first time, a global framework which takes cancer very, very seriously, not least through the Sustainable Development Goals, and they call for a substantial reduction in mortality from non-communicable diseases, of which cancer is a critical component. What this particular initiative is aimed at is really starting to deliver that on the ground in countries across the world by really upgrading the quality of cancer care and treatment and diagnosis in major cities, in cities that currently don't have access to those capabilities, those facilities, that expertise that really will make a difference in terms of reducing the suffering from cancer, but also then reducing mortality from cancer. The initiative will cover all types of cancer. The unique component of it is that it will be focused on cities. And that's really important because now across the world, more than half of the population lives in cities, and indeed that proportion is increasing. So the cities, the focus on cities is one that can be a catalyst for how we deliver improved treatment to all patients wherever they may live.
Our goal is to be able to basically translate what we do at the global level in terms of advocacy to the national level, to be able to provide something tangible for cities and for national governments. What we would like to do basically is work with different stakeholders, including cities, our key partners, ministries of health, our members, and different international partners to be able to help ensure that cities have comprehensive cancer control programs to be able to reach the largest amount of population. But one of the key components which is really, really interesting is that we really want to focus working with not only our partners there's the standard operating partners, all of the people that work in cancer control, but also with city governments, municipal governments. And this is what makes it so interesting, right? Although the City Cancer Challenge really is focused on public health, what we really want to make sure is that cities become involved and are feel empowered to take a stake in this. Because in the end of this, at the end of the project, what we hope is that this becomes sustainable and it becomes part of the regular operating procedure of cities. We also know that, when you focus on municipalities, right, even though it might have a population of 1 million or more, actually the extension, it goes out. So we'll actually have an effect on a larger population outside of the metropolitan area. Because a lot of times, what we're hoping is that essentially we'll have really good reference centers in each of those metropolitan areas. What really makes this project tick is our ability to be able to really engage the key players in each of those communities, in each of those countries that really need to be involved in this. And not just top down, but also bottom up. One of the things that for us is very important is that we don't just work with ministries of health or national cancer institutes, but we also work with cancer leagues, but also patient groups. You know, a lot of times people tend to think that it only is the medical professional that really has anything to do with cancer control. But one of our key messages UICC has always had in terms of our advocacy is that you need to involve a larger group of people to be able to really ensure that you not only give the best care possible, but also are aware of what the specific needs of the patients are. And only patients can tell you that. Only caregivers can give you that, to give you that. So that's why we want to make sure that whatever we decide and whatever type of projects that we design at the city level are really multi-sectoral, that include all those different people, all those different groups. It's ambitious. You know, this is a brand new experience for UICC. UICC has a lot of experience at the global level. We do a lot of work also at the national level, but to be able to provide this type of technical assistance, and it is very, very technical, is a whole new realm of work for us. And I think it's very exciting because global advocacy, you know, really working, fighting to be able to make sure that there's more financing for governments at the national level is important. But what we really want to do is take those messages and convert them into something very tangible, right? So if we get it right, it'll be it will make a tremendous impact on the lives of cancer patients around the world.
By focusing on cities, we can bring together civil society, governments, local businessmen, all motivated to improve the health of their community. It helps us to gather together the infrastructure we need for core cancer services and really to ensure equity of access to cancer treatment for all. This will require not new buildings necessarily, but infrastructure investment in things like radiotherapy machines, but also in the technical skills needed for clinicians having surgery and pathology. But it also requires resources for the massive change program that will be a part of this, to mobilise people who've traditionally not worked together to develop a common vision and to see that implemented in their city. In 10 years' time, it would be fabulous if every city of 1 million people around the world had the genesis of a comprehensive cancer centre, and where the curable cancers were being expertly treated, giving people the same sort of survival that they can expect in high resource countries now.
The big difference in this program is that it's a partnership approach. So we'll be bringing together partners from all over the world, private, public sector, UN agencies, civil society, all of the people that have a stake in bringing cancer services to cities. And we hope that the impact of this will be a collective impact. So there'll be synergies across sectors. The impact will be amplified because people are working together. Coming together, recognising and exploring each other's complementary skills and what each player can bring to the project for success. So we would like to see that by 2025 we can stand up as a community, as a global community of cities, and say by working together we have made a difference.